You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. And we are live on YouTube and Facebook. Evan, how are we doing, man? Happy Father's Day weekend.
Yes, sir. Same to you.
I know, soon enough. The countdown's 10 weeks and counting.
That's
Very
it?
excited.
10 weeks?
That's it.
Holy smokes. It goes quick, don't it?
I know. I'm trying to think about all the things I want to cram in before I'm a dad, but I'm just like, hey, I'm kind of keep a pretty simple, low-key life. So nothing that it's on my to-do list that hasn't already been checked off.
Great, man.
Awesome. And how was your weekend, though? Anything fun?
What did we do? Honestly, my days flow together so much. I mean, my work and my life integrate so much that I honestly can't discern the difference between weekends typically. But I know I went for a hike. And actually, so yesterday I took my brother out for a mountain biking adventure. Yeah. I thought, oh man, I'm really not that in shape. But then I got my little brother out there who he's not in shape at all. And I wasn't out of breath and he was dying. I felt kind of bad. I thought he was going to pass out at one point. So we were like 2 miles into the woods and, he's hyperventilating. I'm like, okay, buddy. Luckily, I had brought some professional grade electrolytes along. And so I gave him some of those and he was able to rebound and feel good enough to get back out to the car. So that was yesterday. That was a blast.
Yeah, I mean, it's amazing. The more you have inflammation under control in your body, just your resiliency for everything, because the more inflamed you are, the more your body is kind of allocating all of its resources to putting out that fire, right? You don't have carpenters go into a house while it's on fire. The firefighters go into the house first. Same kind of thing with your body, and when it comes to performance, getting the inflammation down helps with everything.
I was just in better shape than I thought it was. I mean, it was a pretty intense trail, and I'm assuming that the adaptogens were probably still in my blood at the time, which was helping with performance too.
Absolutely. We also got a new audio setup today, so you can see we're microphone free. Got a little tip from my friend Abel James on how to set some things up, and I think it may be working out pretty good. And hopefully people on Facebook Live can hear you as well. So hopefully, if not, I'll pin the YouTube link as well to that Facebook Live post so they can access it.
Yeah, thank you, Abel.
Yeah, very cool. And we'll take questions here on YouTube chat as we go. But today we wanted to talk about blood testing, just starting out looking at your CBC and your CMP. CBC is your complete blood count, and your CMP is your comprehensive metabolic profile. So your CBC is going to look at things such as your red blood cell sizes like red blood cells, hemoglobin, hematocrit. It'll look at things, and then you also have something called indices, which is like MCV, MCH, MCHC. This is just how big the red blood cell and the hemoglobin is, right? MCH is mean corpuscular hemoglobin, then mean corpuscular hemoglobin concentration. And then MCV is like the width of the blood cell. So it's looking at basically how big the blood cells are and how many of them there are. And then it's looking at also the hemoglobin content and the hematocrit content. And this is helpful because if your iron or B12 goes low, you're going to see your red blood cells, your hemoglobin, and your hematocrit actually drop. And actually, same thing with your B12. You'll start to see those drop. You'll start to see RBC, hematocrit, and hemoglobin start to drop. So that can give you some indications if there's a potential iron or B12, and B12 and folate and B6 tend to come together. So it can give you a pretty good indication of what's going on under the surface. And again, we're looking at these things from a functional perspective. So the ranges that we look at them at are going to be a lot more sensitive than, let's say, a pathological range for, let's say, iron-based anemia, right? Your red blood cell marker may have to be below 3.8 for your MD to say anything. We may say below 4.1 on the RBC.
Yeah.
Same thing with the hemoglobin. Maybe under 11 or so, they may look at it. We may say, ooh, upper 11s, low 12s for hemoglobin. Hematocrit, same thing, like 36, 38-ish. We may start to look at it. They may say 35 or below. So we kind of have a little bit more of a narrower range. So if we're heading in that direction of being more anemic, we know if there's a B12 or iron issue from just those markers. And then we can dig in and look a little bit deeper by looking at the indices, the MCH, MCHC, MCV. These markers get higher, bigger or larger numbers if it's a B12 or B vitamin issue, and they may just stay low if it's an iron issue. But again, it may not have to go low, but typically we differentiate the iron and the B12 because the MCH, MCV, MCHC will start to go up when their B vitamins start to get lower. And why is that? It's because the maturation of red blood cells, they start off really big and they actually get smaller as they get more mature. Where in humans, right, we start off smaller and we get bigger. So they're the exact opposite of human beings. So if we don't have enough B vitamins, they get stuck in this bigger phase and they can't get nice and small like they should. Where if there's too much iron, they actually get too small, right? If you look up, the word anemic, right, it kind of means smaller, weaker, right? So if we don't have enough iron, we can actually get too small. If we don't have enough B vitamins, we can actually stay too big. So that kind of just differentiates that. That's kind of one of the big, what I call deal breakers when we look at someone's blood, is being able to assess significant imbalances either in B vitamins, B12, folate, B6, and then the iron.
So let's give a bit of context about reference ranges. When you go to your conventional doc, you've got LabCorp or Quest or some other lab running your blood, and the doctor or the nurse calls you and says, Dr. Justin, everything's fine. You checked out okay. Go home. Really, you want to make sure you get a copy of all of your blood tests from any practitioner, because someone's analysis may not be the correct analysis. And like we'll discuss a little bit today, we're not going to go too much into the numbers, but we will give some about functional numbers. Anyone who's almost dead and anyone who's alive, they're getting factored into the average. So when you see that the reference range is just so huge, if you're anywhere within dead and alive, you're okay. And for us, that's just not the case, because if you're listening to us, we want you to be the top 1% of health, top 1% of human performance on the planet. And so the reference range is going to be much tighter. So I hear this time and time again, and Justin does too. Every single week, we hear our clients tell us, hey, my nurse said my thyroid was fine. Go home. And then we look at the thyroid and their TSH is just absolutely in the tank. We're in like the single decimal points. We're in like a 0.2 or 0.3, or the TSH is so high, they're like a 6 or a 7, and they get told that they're fine. So don't take fine as a correct analysis of your blood work. Get the piece of paper, and you can work with someone like us, and we can help to identify, are you actually in a functional range, or are there adjustments that need to be made?
Absolutely. And just the people listening on Facebook, give me a thumbs up or a comment. Let me know if you guys can hear me or hear Evan's side of the convo here. We got a new speaker set up, so we appreciate that feedback. So I think we hit some good things. And again, typically how laboratories are assessed is you got 2 standard deviations to the left and to the right, right? This is kind of what makes up our bell curve. And so you have your middle, and then you have 2 standard deviations to the left and 2 to the right. And those 2 standard deviations make what's called the bell curve, and 95% of the population fits in that bell curve. 2.5 on the pathological low, 2.5 on the pathological high. So what happens is there's always 2 standard deviations no matter what. So what Evan said is true. So as the population gets sicker, those standard deviations get wider and wider and wider. So that range gets wider and wider and wider. So it's really important, because optimal never changes. If here's optimal, just because you get more sick people stuck in that reference range, it's going to be polluted. Optimal will look more like it'll look narrower and narrower as the range gets wider and wider. So keep that in mind. So we hit the B vitamin stuff. We hit some of the iron stuff. That's important. Iron's going to be more important with females that are menstruating, because hormonal imbalances like estrogen dominance and low progesterone and cortisol issues can throw off their menstruation and their cycle, and that can cause excessive blood loss. So if I see patients, bleeding more than 3 days and greater than 4 tampons a day, or really going to the supers, that can mean excessive blood loss. So that's one component. The next is vegan vegetarians. Again, really hard. You need to get plant-based B12 sources aren't going to be the best. Even vegans that are really healthy, they need to be supplementing B12. If you're not, that can create a lot of problems. And then also gut issues, right? If we have severe gut inflammation, if we have intrinsic factor antibodies in our stomach, if we have parietal cell antibodies, if we have a lot of gastric inflammation in the stomach, it may be really hard to bind up that B12, because B12 is really interesting. We bind this compound to it called intrinsic factor. And then so here's the B12. It comes into the body via the food, maybe some liver, some really good grass-fed meat. Intrinsic factor binds it. So intrinsic factor is made by the parietal cells. These are the same cells that produce hydrochloric acid. So if we have more gastric stress going on, it's possible we may not make enough of this binding protein. And if we have autoimmune issues, we may actually be making antibodies to parietal cells or to the intrinsic factor. So we may not even have less of these intrinsic factors. So this intrinsic factor hits the B12, it goes through the stomach, it goes into the small intestine, the duodenum, the jejunum, the ileum. So at the very end of the small intestine, before it goes into the cecum, the first part of the large intestine, that's where it gets reabsorbed into the bloodstream. So if we have any of those issues in the gut, that's going to really affect how we absorb B12. And if we have pathological low levels of B12, we can just have maybe immature, big, goofy red blood cells like we mentioned, or we can even go more pathological where we start to have nerve issues, posterior lateral sclerosis, subacute combined system disease. These are issues where your nervous system actually gets destroyed because you don't have enough of that B12 in there to make healthy red blood cells.
Let's go down that avenue. Let's talk about things that would impair stomach acid production. There's a lot of things out there that people are doing, things they're putting into their body, infections that are going on that could sacrifice this. And so if we see blood tests that are going to show low iron, it could just be a malabsorption issue, right? I mean, we see people all the time that they say they're eating grass-fed meats, but they could still show up with potentially low iron because they're just not digesting it well, or they've had a prescription acid blocker that they've been using. Oh, by the way, just feedback for you. Stay close to the mic when you do your visuals, just because when you go away, you sound so distant. And I know like probably 95% of our listeners are audio. So stay close.
Evan, I don't ever want to be away from you, man. No distance at all. I'll get extra close.
Good
feedback. So we hit the B vitamin stuff, right? So also platelets too. Platelets, if they go low, they can also be an iron issue too. So we kind of hit like the big components of the CBC. Let's shift gears, if you're ready, to the infection components.
Yeah, let's do it. So H. pylori is the first thing that came to mind when you're talking about parietal cells. I mean, we see that. What would you say the average is? About 1 in 3 that you're seeing is infected with H. pylori, maybe 1 in 4?
Absolutely. I mean, here's the deal. There are a lot of people out there that probably have H. pylori and are symptom-free. So H. pylori is this helico shape, kind of like a little screw kind of shape, bacterial critter that can burrow itself into the gastric lining. That's the stomach lining. And it's going to be opportunistic. So the more stressed you are, the more immune compromised you are, the more your diet sucks, the more your lifestyle sucks, the more that thing will create problems. So most patients that are coming to see us, most of them are coming because they have some kind of symptom that's driving them in, right? Yeah. You have some that come in because they want to be at their highest level and they're already good, but they want to be better. So if you have an infection, I think it's everyone's right to be infection-free, or it should be everyone's goal to be infection-free. So if there are infections there, we want to get rid of the infection. That's like having a guest come in your house, leave the water on in the guest bathroom that you never go in, and then you see the water bills like 3 times higher the next month. It's the same thing. It's just sucking resources, may not be financial resources, they just may be energy resources, mental, emotional resources that are getting pulled out. So we want to get rid of the infections. That's number 1. Number 2, they're going to affect potentially digestion. And number 3, it's a ticking time bomb, because when you do get more stressed and your immune system becomes weakened, that can really come in there and create more problems.
Yeah. So what do you say to the practitioners who tell their patients or their clients, hey, look, you've got H. pylori, you're not symptomatic, let's just leave it alone, let's not treat it? What do you say to that?
Well, I think we should always get rid of it, because it could potentially be a bottleneck on the digestive system. And then number two, it will be sucking up some kind of resource from the body. So we want to do our best to knock it out. I think the more resources you can have going towards performing at your optimal level, to cognition, to brain function, to rebuilding muscle and healing tissue, and going to your healthy anabolic hormones, that's better. We want to allocate our resources to things that are going to help us grow versus frivolous things, right? So it's kind of like investing, right? You want money going to assets and to things that really make your life, better, food, shelter, those kind of things, versus to all the things that may not be as much of a priority.
Yeah, I think I told you this already, but I'll say it again, just make sure it's on the air. Is I had a client who came to me a few weeks ago who went through a medical doctor. He did test positive for H. pylori. And I said, did you get treated for it with the MD? He said, yes. And I said, oh, what was it, triple therapy? And he goes, no, they're doing quadruple therapy now. And it's 4 antibiotics instead of 3 because the H. pylori is getting so resistant. We probably have to do a whole podcast on antibiotic resistant bugs and how big of an issue it is. But long story short, the guy did 4 antibiotics at the same time and tons of digestive complaints. Still showed up positive for H. pylori. So it didn't work. Wow.
Right, didn't work. Yeah, triple therapy is typically clarithromycin, amoxicillin, and typically Prilosec or bismuth they'll use in there. So I wonder what the 4th antibiotic they're adding in, or the 3rd really, because Prilosec isn't the antibiotic.
Yeah,
clarithromycin and amoxicillin are. So that makes.
I'm pretty sure he said it was. I think it was Prilosec, so the acid blocker, and then 3 antibiotics. I'm not sure what they were though in terms of the strains or anything.
And I see so many patients that have zero acid reflux or heartburn symptoms, and they still put them on Prilosec, which is just retarded, because it's like, if they're not having issues with stomach acid and irritation in the gut, why are you putting them on a blocker that may decrease their stomach acid and create more nutritional issues down the road? It's just silly. I get it if they have a lot of the acid reflux, but if not, it's like, why are you adding another drug on there?
Yep. There's a couple markers I wanted to see if I could find him here in our clinical handbooks on blood testing. There's so many markers that show up as hypochlorhydria. Do you know any right off the top of your head? I guess you talked about iron already. So if you had iron issues, we know that could be like excessive bleeding. But if you're a male, you could still show up low just due to hypochlorhydria, right? Just low stomach acid.
Yeah, you can. Absolutely. And that may not be pathological, right? It may be more of a subtle kind of thing. And here's the thing. When it comes to functional medicine, we're moving so many needles. You don't really know what needle per se is really making the difference, because we may give you hydrochloric acid, right, and some enzymes, but we may also try to get you to have more time chewing your food and then drinking water away from food and eating in a more stress-free environment. So you're moving 6 or 7 needles right there. I may say go out and get a little bit more sunlight and vitamin D. So there's 8 needles we just moved. So in a double-blind, placebo-controlled trial, typically they're moving 1 needle at a time. Well, man, that'd be the slow boat to China. If you're moving 1 needle at a time as a functional medicine practitioner, it'd be so hard to figure out what is the absolute variable, and it would take forever to get patients to get better. That's why I always say, if you can glean from clinical research, do it. Like, the research you see on PubMed per se. But a lot of times the clinical research that we're doing, you're moving so many needles, it's hard to know what one, but it's okay, because every needle we're doing on the lifestyle side, we know is helpful. Like, it's not ever going to hurt anyone to be in a more relaxed environment to eat, or to drink water away from food, or to chew your food more, right? Those things are going to help everyone for the most part. So we combine all of those things with the other stuff, and we may see improvements in the B12 or the iron or other digestive things. So sliding back to the H. pylori, we may look at it indirectly if we're looking at a CBC, right? We may look at what's called our white blood cell markers, right? And this is a general kind of indication of our neutrophils, lymphocytes, monocytes, eosinophils, and basophils, all right? In doctorate school, we learn it, never let monkeys eat bananas, all right? That's kind of the general gist. And then neutrophils have the highest content, about 60% of your white blood cells are neutrophils, all the way down to the basophils, which is like 1 or 2%. So kind of keep that in mind. Neutrophils can go up or down for bacteria, lymphocytes for bacteria and viruses, monocytes for gut inflammation, bacteria, and potentially parasites. Eosinophils can go up for typically parasites and allergies, and basophils for histamine and allergies too.
Now, is your typical blood test going to have these broken down like that, though, or are you just going to get a generic white blood cell count?
Yeah, typically you're going to have on your CBC your white blood cell number, which will be all of those, neutrophils, lymphocytes, eosinophils, basophils, monophils combined, or monocytes combined.
Yeah.
That's your white blood cell number. And then you can get a breakdown of all of them. And you can get a percentage. You'll get a percentage breakdown as well as the absolutes. So the absolutes, how much eosinophils are in there, and then you'll get the number as a percentage too.
All right. So let's say I just got my blood work done. I didn't get the breakdown though. I've just got white blood cell count. Can we make general inferences about whether white blood cell count, let's say they're currently up, you could say possibly active infection as compared to if white blood cells were down, could you have said that that's a chronic infection, but 100%. That the body's not been able to fight it any longer?
100%. So when you look at white blood cells high or low, if it's high, it's going to be an active infection. That's non-specific though. And if white blood cells are low, that's definitely going to be more of a chronic immune depleted kind of situation. And then from there, we can run the actual individual white blood cells and we can infer what may be happening there. So a typical pattern is like neutrophils high, lymphocytes low. That's a common H. pylori pattern. High neutrophils, low lymphocytes. Typically, once you get into the mid to low 60s, that may be a problem.
Now, let me clarify here. Is this high neutrophils in a functional range, or even like your conventional LabCorp would flag you, hey, look, your neutrophils are high?
Yeah, you probably would not get, well, I mean, the functional range is going to be in the low 60s. Okay. The lab pathological range typically is above 70. Some go as high as 75.
So maybe your conventional lab will pick it up, but maybe you've got to use a functional reference range instead.
Exactly, 100%.
Okay, so basically what we're kind of getting at is we can detect stuff like this H. pylori. We can guess parasites possible based on some of these other components of the white blood cell count. But if any of this stuff is off, whether your white blood cell count just as a whole, regardless of the breakdown, if the whole WBC is up or down, we could say that warrants further investigation with something like stool or urine organic acids testing to actually look and prove on a piece of paper H. pylori is there.
100%.
Okay.
You got it.
All right.
Absolutely.
We got a couple questions. Let's see. Samuel asked about lots of ketosis lately. He said, can you give us examples of a day of eating ketosis? It's pretty much meat and fats. I mean, like I'm probably in ketosis right now. Did some pastured sausage for breakfast. Half of an avocado. I would say I'm definitely producing ketones right now, Samuel. Same thing, probably meat and some veggies later for lunch, and meat and veggies for dinner. Like probably do a grass-fed steak tonight. Actually, you know what? I made fajitas last night. I made some grass-fed beef fajitas, so I'll probably do those again. That's just bell peppers, onions, and maybe a piece of dark chocolate. So I'll probably be ketotic during that meal. Kendra loves blood test analysis. Acacia said, how do you work? How does she work with us? You could just Google Dr. Justin Marchegiani or go to his website, Justin Health, and then you can check out my website, evanbrand.com. Samuel, how do you know if herbal treatment for H. pylori is working to eradicate it? Are there any symptoms during the 2-month protocol? What would you say, Justin? I mean, sometimes it's not symptoms during the 2-month protocol. It's just a matter of the removal of bad symptoms. So it's like stomach pain. Like you told me, I said, man, I had this weird sharp pain in my stomach. You said, oh, right. Man, you better look for H. pylori. So it might not be that symptoms like more energy, but it might be the removal of things. Like instead of more energy, I phrase it as the removal of fatigue or the removal of gut pain or the removal of diarrhea or constipation. So I kind of word it as like a removal of the bad thing, like pulling off the layer, as opposed to saying, here's your positive symptom, if that makes sense.
Yeah. So you make your list of the conventional H. pylori symptoms, which will be, gut irritation, acid reflux, gastritis, indigestion, constipation, diarrhea, like a lot of your big GI symptoms, right? But then you kind of have your atypical symptoms, which could be joint pain, mood issues, fatigue, depression, anxiety, brain fog. So energy, right? So a lot of those things, depression, a lot of those things are going to be atypical, meaning they're outside of the digestive sequelae of symptoms. So we got to keep that in the back of your mind. So typically you're either going to see an improvement in some of those symptoms, right? So if you had mood stuff, you may see improvements in the atypical stuff like fatigue, energy, joint pain start to go down. You may have some typical gastric symptoms like the bloating, the constipation, the diarrhea. So you kind of make a list and see what improves on the typical and what improves on the atypical. And again, most people are going to see some level of improvement there. But in general, the goal is to reduce, kind of pull those stressors out of our stress bucket. And the more stressors out of that bucket, you may get better. Some people, if you could kill too fast, they may feel worse during that killing phase. I can't tell you how many patients I have where we create, a die-off reaction handout. And if you have these issues, make sure you curtail the dose, adjust it, taper it up. So many patients ignore that because they just kind of go into this mindset of like the faster the better, the more I kill the better. And so they feel like crap. And then they don't even do anything or follow the instructions to modify the dose. So I always say, if you're really feeling like crap, that means you're just stressing your immune system, your lymphatics, your detox. You're killing things off too fast and your body's having to deal with that dead debris. Slow it down, add in some things to help with lymphatic flow, ginger tea, maybe add in some binders, some bentonite clay, some charcoal, some citrus pectin, and then maybe even add in some extra things for your detox phase 1 or phase 2 nutrients to help push those pathways. But that's a good start right there.
We got a couple more questions here. Avi, are there any books you guys have read about functional medicine that you recommend? I don't know if I would consider it a functional medicine book, but Dr. Jonathan Wright's book, Why Stomach Acid's Good For You, I think is pertinent to today's discussion, and it's like $9 on Amazon. What about you?
I got a book coming out, man, The Thyroid Reset. That's going to be a great book, all the practical things. I know I'm giving myself a plug, but it's going to be great because it's going to be all real practical things. So look for that soon, and we're going to get that out. I'm too busy with patients, so I need to get someone on board to help get it done because I don't want to take away from my helping patients.
Totally. All right, so outside of your book's going to be a good one. I know. I'm excited. What about other recommendations?
From a functional medicine standpoint, I mean, we have some books here that are more clinician oriented right here on blood testing and such that I use.
Dr. Weatherby. He's got a good one. It's titled Blood Chemistry and CBC Analysis. That one's a cool one. There's a couple other ones out there. What's the other? I would give
Isabella Wentz a plug, The Hashimoto's Protocol. It's a really good book.
Yeah, Isabella's book was really good. What else did I read so far this year?
I got another book over here, Dr. Horowitz's book, Why Can't I Get Better?
That's a great book. He's got a new one now too, Horowitz. I can't remember what it's called. I think it's
a play off the same word.
Yeah, it's like I can get better.
I can get something like that. It's like a play off that same theme. So yeah, those are some really good things there too, for sure.
You want to answer Kendra's question, and then we'll go back to the blood here.
Mm-hmm. So let me hit one thing. So I talked about kind of the white blood cell stuff and then like the breakdown of the blood cells. Now there's specific tests that you can do for specific H. pylori antibodies, right? IgA, IgG, IgM, and then also you can do breath testing and then also stool antigen testing. So there's more specific testing, but you can look at the CBC and you can infer and draw things from that, which is nice.
Okay.
And then what's Kendra's question?
Yeah, she says, do you consider elevated eosinophils a good sign, a good enough indicator of infections, or do you think stool tests are always necessary? I'll give my 2 cents first. We run a stool test on every single new client. I mean, if we just depended on blood tests, I feel like us having all the puzzle pieces on the table would not be complete.
Exactly. And sometimes it can take a long time for those markers to drop. So if you're treating an infection, it may take like months after the infection's treated for those numbers to kind of slowly go down. So it's nice to have more immediate infection markers that tell the story. But it's good because number one, it tells me, the clinician, that something's wrong and that we got to look deeper in that stool testing area. And then it gives me more ammo to get the patient to run the tests that I think are best. So that way the patient's more motivated because they know, here's the clinical direction that we're going down, here's the clinical path we're going down, and here's why we're going down it.
Yeah, she had a follow-up question. She said, or rather, should you not do a stool test if the CBC doesn't indicate parasites? No way. Always do stool testing. I'd say once or twice a year, just as a preventative, everybody should be doing stool testing, because here's the deal. We could try to make guesses and checks based on the CBC, like, oh, we think it could be this, we think it could be that. But let's say you've got like Klebsiella or Citrobacter, some type of bacterial overgrowth that can trigger autoimmunity. But let's say you've also got H. pylori on top of that, or let's say you've got Candida, or let's say you've got Blasto with it. You know, the protocol is going to be different. If it's just yeast, we're going to do one thing. If it's just bacteria, we're going to do one thing. If it's bacteria plus parasites plus yeast, that's going to be a totally different protocol. So if you just say, oh, I think this number's off on my blood, therefore I'm going to take this gut supplement, waste of time.
100%. So I think that's essential because you're going to treat different infections differently. And then also you want to know if the infection's knocked out, because if you don't see the CBC go down, you're like, well, it's just kind of in a latency period. Is it going to drop over the next few months? Where if you get the infection, you retest and that infection's still there, you have a lot more clinical confidence to keep on moving and trying different things versus, hey, did you get it? You're not kind of in an uncertain state.
Another question here. Do you agree that low melatonin on a biohealth HPA axis spit test, low melatonin, do you believe that indicates gut dysfunction?
It definitely can. It can increase or can be, something that I would add to the list of potential differential diagnoses of what the root cause could be. Because if we don't have the ability to break down, let's say, tryptophan, which then gets converted into 5-HTP, which then gets converted into serotonin, which then gets converted into melatonin, right? That could be a potential issue. I also look at B6. I also look at just stress, because your body will burn through serotonin the more stressed you are. You'll see that on an organic acid test. You'll see 5-hydroxyindole acetate go high or low. So that could be an indication you're burning up a lot of those precursors there. So I look at the stress components, adrenals and such, and I also would look at the gut component for sure, and then make sure all the diet and lifestyle things are the T's are crossed and the I's are dotted, right? HCl, enzymes, no infections, making sure sleep is good, all those things. But definitely that's one thing I would add to the list to rule out.
Yeah, it could be something simple as you looked at your phone too close to bedtime. Low melatonin showed up before your last saliva test.
Yeah, I mean, I would say if you're like running the test right before that, for sure. But if you're kind of getting more of an average, so to speak, of the night and it's low, that's probably not enough to knock it down from an average standpoint. But punctuated, yes, I think that makes sense.
Yeah. Let's see what else we had questions here. Diana said, do you recommend nystatin for yeast overgrowth to keep it in check while taking herbals? I can't prescribe, and I would not prescribe it even if I had the ability to prescribe it, because I typically use like Saccharomyces boulardii, and I've just never had issues with yeast overgrowth as long as people are doing the diet. And a lot of the herbs that we use, and Justin, I know you want to add some stuff too. A lot of the herbs we use, like if we're working on yeast overgrowth or parasites or bacteria, they're going to be multifactorial. So we may be using an herb that's going to also, let's say we use olive leaf or oregano, that could kill bacteria, but it could also kill yeast as well.
Yeah, absolutely. So I think nystatin and some of the antifungals may be needed for more severe issues, but for the most part, you should always try the herbals first, and you should always look at other infections, because there could be other infections like blasto or H. pylori that could predispose that fungal overgrowth. And if that's what's predisposing it, a nystatin or a fluconazole or an amphotericin B, that's not going to fix the H. pylori or the blasto, right? Yeah. So then the root underlying issue is still there. While you, basically you went outside, you pulled the weeds at the ground level versus pulling the roots up. So that's the equivalent of just pulling the weed out at the surface and not pulling the root out.
Yep. Well said. Samuel said, how accurate is the breath test for H. pylori? I've personally never actually recommended one for a client because the stool testing is just so awesome that I prefer to use that. But Justin, what's your take on that?
Yeah, I mean, if someone has insurance and they've met their deductible, I'll throw it on there and order it from LabCorp. But I find that patients may still have an H. pylori infection in their stool and not have it come back on the breath. The breath is good for like acute stuff, but it's not something I'd ever just run by itself and say, yep, you're good. I'd always want to go to the gold standard, which is the H. pylori testing. And again, we've been doing a lot of the DNA testing for the H. pylori, but BioHealth, their 418 or the 401H, the H part of the 401 does the H. pylori, and they do great parasitology on their H. pylori. They beat a lot of labs in that, which is awesome.
Yeah, it is. Avi had a question. Should I wear blue blockers all day on the computer or only when it gets dark out? I'm so glad you answered this. It drives me nuts when I see people promoting these blue blocking glasses and they're like out at events, like a health conference, and they're just walking around during the daytime wearing your blue blockers. It's absolutely retarded because you're destroying. I've seen people on the lab results who said they've been wearing blue blockers all day. They've destroyed their cortisol rhythm because their body never knows when it's daytime. So, and this is not against you asking the question, but I see so many photos of people promoting them because they're like trendy and cool now, but it's absolutely stupid to wear them during the day because you can just use a screen software like Justin and I have talked about called Iris, and you can keep your screen at 23 or 1900 Kelvin. So it's pretty much an amber color, which is what I do all day, because you still need those beneficial spectrums. There's like 1500 different spectrums you're getting from sunlight. So if you're exposed to like an LED light or a screen light from your computer, you can modify those lights to make it a better situation, but you absolutely still have to have those natural spectrums that come from the sun. Otherwise, you're really screwing yourself up.
Yeah, I mean, during the day for me, I'm okay being a little bit overstimulated by light during the day because that's just going to increase my cortisol. So if as long as everything else is going well, I don't have a significant cortisol imbalance, I think it's fine. I just use it at night. Just when the sun sets, that's where I pull them out. And I have the Swanwick brand now that I put over my glasses, and I'll put them on typically between 8 to 9. The last 2 hours before I go to bed, I put them on.
Yeah. And I go to bed so early with the baby. So, I mean, at the time in the summer, we're going to bed before it's even completely dark outside. So I just candle down. I mean, we've got like a little salt lamp we use as a nightlight, and turn that off, and we're good. So
love it. Love it.
I got a little ranty there. I see these pictures of these blue blockers and these people wearing them, promoting them at health conferences. There's people doing like Facebook ads wearing the glasses during the day. It just makes me want to sock them.
Yeah, I think I had the neurosurgeon on there, Jack Cruz, recently, and he had him on during the day. But his situation was different. He was up all night doing a neurosurgery, so he had it on the next day because he was trying to, I think, probably get to bed when he got home. So I think he was trying to dampen it and kind of tell his brain that it was nighttime, so he could get some rest. So I think that was a different situation. People watch that show, you're probably thinking about him. And I know I can think of a couple other people that do it at conferences quite frequently. I won't say their name, but I just don't understand during the day why that's going to be the best. I get it at night, right? Because you don't want to lower the melatonin by upping the cortisol from the light. So that makes a lot of sense.
Well, the sun, I mean, right now there's blue light from the sun. You're getting blue spectrums during the day. And so
naturally.
Yeah, naturally. So it's not like you're hacking sunlight. Sunlight is good. You're never going to be able to beat that in terms of the spectrum, the color ranges.
Totally. Well, we just hit the CBC today. I think we save the comprehensive metabolic profile for next time because we've already done a good amount. We hit the key CBC markers, RBC, hemoglobin, hematocrit, right? We talked about the differentiating the iron versus the B12. We talked about the white blood cell panel, right? White blood cells. Yep. We talked about the neutrophils, lymphocytes, eosinophils, basophils. And then one other marker here I'll hit is, well, we'll hit it in the CBC and the CMP part next time, but you can do markers for red blood cell magnesium, which is great, but magnesium kind of comes under the comprehensive metabolic profile. So we'll talk about that, intercellular versus extracellular. So we always like to do, if we can, do a specialty test for like the magnesium serum versus, red blood cell magnesium. That's better because that gives us a window intercellular inside the blood cell versus outside of it, kind of what the blood cell swims in, if you will.
Yep, that'll be fun.
Oh, awesome. Well, any other questions, comments, concerns?
We had one from Gupta here. K. Gupta, what's the best hormone test? Kind of a general question, but since we've talked about cortisol and melatonin today, a lot of times we're looking at a salivary cortisol test, which is going to tell us a lot about gut health. If you've got high cortisol, we know that's going to damage somebody's gut. So that's what I'm typically running. Justin, what are you doing hormone-wise?
Yeah, hormones, I've been doing a combination between the Dutch and then also doing more of the biohealth, the cortisol awakening response. So we'll run the 201 or the 205, and then we'll add the cortisol awakening response so we can look at 0, 30, and 60 minutes waking and see if we have that nice bump of cortisol here, a bump at 30, and then a halfway drop down here. A lot of patients are not even getting that cortisol up. So in your awakening response, we get a bump, 50% bump, a drop of about a third here, like that. And most people, they aren't getting it up high enough and they're dropping down actually lower. So that gives us a pretty good window of what's happening with our HPA axis.
And it is so much more fun to have the awakening response versus in previous times, us just having that one morning reading.
It's nice. It gives you a pretty good window of what's happening with the brain and the hypothalamus, pituitary, adrenal axis for sure.
I love it. Stacy, thank you for the feedback. We appreciate it. Kendra said she gave us a podcast idea, a recommended test, serum, urine, etc., for each essential micronutrient: magnesium, zinc, B6, fatty acids, etc. I'm going to guess you're going to tell her just to do a SpectraCell, but maybe we'll save that for future reference.
Yeah, I mean, SpectraCell will be great because you get more intracellular nutrients there. But yeah, we'll talk about that next time. There's other markers that we can look at for zinc, like alkaline phosphatase, and magnesium, like the red blood cell magnesium. So we'll save that for next time. We'll dig in more.
Cool. People can go check out justinhealth.com. You can check out Justin's store, custom formulations there, lab tests, scheduling consults with them, justinhealth.com. And then myself, just Evan Brand, EVAN brand.com. And check us out. We've got probably a combined total of 500 or 600 pieces of content. So if there's something we didn't cover today, I'm sure we have in some form or fashion.
Yeah, just use the search bar on our site. A lot of people, they come in on some of the questions and they ask questions like about stress and things like that. We may not be able to answer more very generic questions, but that's why I go back to the site and just put that into our search browser, and you'll get lots of podcasts and other articles on that. So we don't mean to ignore you, but go back and use that search bar first.
Yep, totally.
Cool. And you're no longer the Not Just Paleo guy. You changed your brand. I mean,
it's gone.
Evan Brand changes his brand. Is that a coincidence or what?
It's gone. The website went down, and I said, you know what, this is it. I finally got it. I was able to purchase my name.com. So that's what I did. Stacy, is it okay to take D3 on a regular? Yeah, it probably is. If you're taking vitamin K or you're doing grass-fed butter, then you've got the K that's going to help act as the traffic cop for the calcium, so that you're not upping D3 and then calcium's going to your arteries. But just get your levels retested. I had a lady who was taking a bunch of vitamin D. She got her levels tested. She was above 120. And that's toxic. So you can't have too much of a good thing. So just get your blood checked. If you can get it through your doctor, cool. If you need to get it through somebody like Justin or myself, we can do it on an out-of-pocket basis as well for blood. And it's always good to check. Make sure you're about 60 units.
Love it, man. Love it. Well, anything else you want to mention here before we go?
I don't think so. If people listen on YouTube, they can't give us a review, obviously. But if you're listening to the audio portion on iTunes, give us a 5-star review, because it helps us stay in the top of the health charts. And that way this functional medicine approach can get to more people. And then we beat out people like Jillian Michaels, who are promoting like calorie counting and weighing yourself and weighing and measuring your food and all that other crap that we just don't agree with, that is not necessary for you to be optimally healthy. If you give us a 5-star review on iTunes, we beat out her. And then this info gets to people like you instead.
100%, man. Awesome. Well, great chat today, Evan.
Likewise. Take care.
We got to do it again real soon.
Yes, sir.
All right. Take care.
Bye.
Bye.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.